Oluwatosin Smith. Everybody calls me Tosin. I'm with the Glaucoma Associates of Texas in Dallas. So it was an exciting session because not only did we visit some new procedures that are out there, but we spent some time also looking at how to treat or address complications of some of the older surgeries that we had done and we have done over the years. Cyclodialysis clefts, as we all know, could be complications from angle-based surgery, and knowing exactly how you can repair those becomes more important because now we're doing more and more minimally invasive glaucoma surgery. So it was a good overview from anything as it came to repairing complications of other surgeries and looking to newer surgeries, because now there's a procedure where you actually create a cyclodialysis cleft, and learning the steps that are involved with doing that procedure was also one of the things we looked at. It was a good array of different topics that we discussed in that session that will be helpful to most people who are just who do just cataract surgery or minimally invasive glaucoma surgery. So it depends on what initially caused the patient's hypotony. For procedures where you develop the cyclodialysis cleft, it becomes appropriate to then do the repair. And the interesting thing about the video is that the video had actually different approaches to repairing a cleft. And there are different ways of doing it. I think technically there are more challenging ways, and then there are simpler ways of repairing the cleft, like putting in a CTR in the sulcal space could help you repair the cleft, or you could do a direct visualization repair of a cyclodialysis cleft, which tends to be a little bit more complicated. Hypotony was also addressed in people who have had drainage implants. Drainage implants have been around for a long time. Being able to put a proline suture to stent the tube ab interno without having to revise the entire procedure was another thing that we looked at. I think mostly what's interesting about the session is the fact that we have new tools in terms of instrumentation. We have new ideas. We have different tricks now available to us that we can use to do the surgeries that makes it minimally invasive. It's like a minimally invasive approach to complications versus, the standard traditional ways we have done them in the past. So I think there were lots of pearls that were given in the sessions. If I look at some of the videos, for instance, it ranged from looking at minimally invasive glaucoma surgery and improved implantation or techniques for implantation of devices in the anterior chamber angle, whether it was an iDose or a stent like an iStent or a Hydros device. It was good to actually have discussion between surgeons as to how to help surgeons approach that and techniques that will go beyond just the traditional teaching them how to do the procedures to actually being a better surgeon in the angle. Another thing was, for the people who were starting out early, there was a video that actually went through the approach of hands-free gonio prism used in minimally invasive glaucoma surgery. That I thought also was really good, especially for those people who are starting out. And lastly, there was many times we have the opportunity to take cataracts out in patients with angle closure, which is not the traditional thing that we tend to talk about when we talk glaucoma. But doing something as simple as goniosynohyalolysis with a gonio prism view of the anterior chamber angle could actually address the patient's glaucoma. So it was a really neat session that looked at either repairs to complications, newer surgeries, or old-time approaches that we probably don't consider as often as we should. For the trainees, I think, first of all, it was great to just see the array of different procedures that there are. The mindset that glaucoma surgery is only one type of thing. This particular session showed you different approaches to either repairing or treating glaucoma. The other thing about it also discussed in various ways easier steps to adoption, being a better surgeon in the angle, because now you have people who have acquired skill, and we're able to then discuss the best approach or the best surgical approach to some of these procedures to make it easier for those people who are coming after to learn the procedures. So I would say it gave good exposure to glaucoma as a whole. an array of different types of procedures that there are. Minimally invasive approach to glaucoma surgery, but also techniques and tricks to being a better glaucoma surgeon.